Hello guys, Dr. Qureshi here, and today I will be talking about certain things that I can see right away when I enter the exam room. I look at the patient's eyes as they're talking to me and I'm introducing myself to my patients. I'm looking at them, I'm observing them, and I'm trying to figure out a lot of things as soon as I enter the exam room. And the patients are not even aware of that, so that's the coolest part. But it saves me a lot of time and it also kind of focuses me in what I'm looking for and what kind of questions to ask my patients. Obviously, my staff, my assistants, the nurses, and the technicians have already done the history. They have already given me the information that I really need in the exam room, in the EHR, on the computer screen. But at the same time, I need to focus on things that I am observing also. So, some of the things that I wanted to mention today would be things that I see on the eyeball as I'm talking to my patients. And I'm going to show you my wonderful eyeball here. It's a model, so I'm going to show it to you today. That's what it looks like. It's a wonderful model. And I'm going to show you the different parts of this eye model. But I'm also going to show you certain diseases on my computer screen today. So, the first one that we're going to talk about is the corneal arcus. When the patient comes in the exam room, I'm looking at their eyes and I see a white ring around the transparent part of the human eye, which is known as the arcus. The cornea is a transparent part and you can see the arcus around it. So if you look at my eye model here, this is the cornea, which is the transparent part, and around the cornea you can see the arcus. And I'm going to show you a picture of the arcus also so that I know you guys understand things better with pictures, and that's what I'm going to show you. So if you look at my computer screen here, this is what the arcus is going to look like right there. You see that white ring around it? That is known as the arcus. So what does it mean? Well, if you see an arcus in someone who's older, then it's normal, okay? Because that is known as an arcus that happens in older age groups, which is known as the arcus senilis. But if you see it in someone who is under 40, then definitely you have to figure out if they have hypercholesterolemia, if their cholesterol levels are high. So remember the age difference. Under 40, definitely we will be more concerned, but if it's someone in their 60s, 70s, then it is something that can happen in older age groups. Okay, so that was the arcus. And one more time, I'm going to show you the picture so that you remember it really well. And that is the ring, the white ring around the cornea, around the transparent part of the human eye. That would be the arcus. Okay, now the second thing that I will be talking about today is xanthelasmas. So when I enter again the exam room, I'm looking at the patient's eyes and the area around the eyes, like the orbital area. So I can show it to you on the eye model, but I can show you a picture because this happens when they have some bumps and they look very yellow, okay? And these are present right on the eyelid, okay? And this is what they look like. So this is the patient's picture. These are just random pictures that I picked out for you guys. And if you look here where my pen is, or I'm pointing with my pen, this is a xanthelasma. And this one is a xanthelasma also. You can see that is an elevated area right there. So this is a xanthelasma. And these can happen in patients who have high cholesterol also. So what do I do with these kind of patients? Well, I refer them out, right? Refer them to their primary care doctors to make sure their cholesterol levels are under control with the help of medications, diet, exercise, and whatnot. Now, if they already have a history of hypercholesterolemia, then I can always educate them about it and tell them that they have to control their cholesterol levels with diet, exercise, and medications, because that's a classic sign that the cholesterol levels are high with the xanthelasmas, okay? And at some point, I have removed these xanthelasmas with the Elman unit. You have seen that in my surgical videos where I'm removing lumps and bumps and papilloma. I can similarly remove the xanthelasma with the same instrument or with the same machine, which is heat guided, but sometimes it can come back also. And I do not think I have a video on removal of the xanthelasma, but I have removed it. And the patient was actually very thrilled because they felt like it was bothering them aesthetically more than anything else. So yes, I've removed it, but it was a medical necessity, because of which I did remove that. So far, we have talked about the corneal arcus and the xanthelasma. One other thing that I have made a video on, and I'm pretty sure you guys have watched it, is blepharitis, which is crusting of the eyelashes. I cannot show it to you on my model because, as you can see, my model does not have eyebrows or eyelashes, but I can show it to you on the picture here. It's a very cool picture where you can appreciate the eyelashes with the crusting on them, like right there. You see all this crusting on the lashes. This is known as blepharitis, which is inflammation of the eyelashes. Okay, so for this, as you can see in my video on my channel under blepharitis, I give them lid scrubs to remove the crusting with, or if it is really advanced blepharitis, which causes itching and inflammation and irritation and swelling of the lid, then I also treat it with the help of an antibiotic or steroid ointment, and I tell them to keep their lid hygiene really good with the help of the lid scrubs. So that was blepharitis, and then we are going to talk about certain conditions of the iris and conjunctiva. So that I can show it to you on my eye model. So if you look at the conjunctiva, so the conjunctiva is going to be the white part of the human eye. So if you look at my eye model, this part will be the conj, the white part, right? So then if you look at my photo here, excuse me, so this is the conjunctival melanosis. So this is the conjunctiva, the white part, and you see this brown area here. Sometimes when you're talking to people, or my patients, especially when I'm checking their eye muscle movement and I'm asking them to look down, look up, look to the right, look to the left, that's where I can see this. And sometimes you have to elevate the lid also in order to appreciate how big the melanosis is, okay? So because if the lid is covering this area, and let's say the melanosis was not visible, like in this area, but it was like under the lid, then you could have missed it. So absolutely evert the lid. And this melanosis is benign. It's a benign condition, but it can turn into a malignancy also. In that situation, it is known as a conjunctival melanoma. That is not a benign condition, that is a cancer. And then we have to refer the patients out to an oncologist, most likely. Have I seen a melanoma? It is rare to see them in the practices where I've worked, but I have seen a few cases. I would just say a few. Most of the times it is melanosis. So in order to differentiate a benign condition from a malignant melanoma, you have to look at the margins, you have to look at the size, you have to see the progression, the growth, and the surface elevation, and the color changes also. So that is a melanosis, and these are commonly seen, the melanosis, not the melanoma. The benign condition is melanosis. Then we're going to talk about something called iris nevus, okay? So for this one, it's the iris. So I'm going to show it to you on my eye model again. So this is my eye model, and I'm going to open it now, okay? So as you open the eye model, you can see the iris, which is this area, the color part of the human eye. So I'm going to move it like this for you to appreciate the colored part, okay? So in this colored part, you can see something called a nevus, which is again a benign condition. So this is the human eye, this is the colored part, which is the iris, which has the pigmentation, obviously, pigments, and this is the iris. So this is a benign condition, but it can turn into a malignant condition, which is known as, again, melanoma, and that becomes a dangerous or severe or serious condition. But right now you can see that this is a nevus, and a nevus is a benign condition, like I said. So we monitor a nevus every year when the patient comes in. If you start noticing changes in the color, size, growth, progression, surface elevation, and the margin changes also, then definitely send them to an oncologist. It becomes a very important or serious condition at that point, okay? So now going back to the eye model, now I'm going to show you something. As I open the model, you open it like this. It's a really cool model. These are all the parts of the human eye that I'm putting on the side. So this is known as the vitreous. This is a thick gel-like consistency, and this sits in the eye. So this is very cool if you want to visualize that. This is basically gel-like consistency, vitreous body. This sits here by nature, by God, and it protects our retina, which is this part. The innermost part is the retina. Okay, this is retina, and this is obviously is the lens. So the retina obviously has blood vessels and everything that I have shown you in other videos also. So this is the retina right there. That's a good view, I think. You can see that. So this is nature's way of protecting the retina so that it doesn't get detached. This area is supposed to be thick gel-like consistency, but over the years it can liquefy, and you can see a few strands floating around, and those are known as vitreous floaters. PVD, posterior vitreous detachment. I have a video on vitreous floaters. It's a separate video, but I do not think I have uploaded it yet, but I will at some point. But in the meantime, I'm going to show you what the patients tell me in the exam room. This is what they see with the vitreous floaters. They say, oh, you know what, doc? I am seeing these black threads or like flies floating around in my field of view. So this is what they look like. They could look like bugs like this, or they could look like threads, or like ring thread. Those kind of terms are used commonly by my patients in describing the vitreous floater. I hope you can see the picture good here, and you're not seeing any kind of glare on it. So that's the vitreous floater right there. These are all different types of floaters that you can see on the picture where I'm pointing at. So you can see the thread like this. And most of the times my patients will say that they're seeing the floaters in the white light. Like, you know, when it's a sunny day, they can see them, or they can see them more in the white light versus the yellow light, which is the mood light. Okay, so that's the vitreous floater. And again, it comes from this area, the vitreous body, as it liquefies. It's supposed to be thick gel-like consistency, but over the years, as we grow older, it can become liquefied, and you can see a few strands floating around. So that was that, and I think I have covered pretty much everything. And then going back to my eye model, I mean, just remember that, of course, as the patient is sitting there, I cannot see the vitreous floaters without examining them, but I can definitely, if the cataract is advanced, like it looks very opaque, like a very advanced cataract, as I'm talking to the patients, I can see the opacification even through the cornea, or through their pupils basically. And I think I have a video where I have talked about the opacified or very dense hypermature cataract, which is visible to the naked eye also because it looks like a white area through the pupil. And then when I open this eye model even more, let's remove the lens also, then you can see the retina, which is this area here, okay? And then as I'm examining them, then of course if there's bleeding going on with diabetic retinopathy or hypertensive retinopathy, all of those things will appear in this area. And if they have any kind of pathology in the optic nerve, like swelling of the optic nerve, bilateral with papilledema, or in one eye if there's swelling of the optic nerve, then I can see that in idiopathic intracranial hypertension, or I can even see optic nerve atrophy, glaucomatous optic nerve. Like there's so many different things that I can see in this area. But then going back, I mean, these are the things that are examined later on after the slit lamp examination is done. Then I can see more things. But in general, when the patient is just sitting in the exam room, in the exam chair, as soon as I enter, there's a lot of things that I can see. So I'm going to, So I'm going to put the eye model back in its actual form. And this is how it looks like. This goes here. Actually, let's put the cataract lens later. So this was the vitreous body. And then we put the lens in there. It's fun doing it, actually. The lens goes first in there. And then put this here. And then lastly, we put the cornea right there. So remember, this one is a complete eye model. And my patients who are kids, they love playing with this eye model. I notice when I enter the room, they're playing with it, which is nice because they're trying to learn. And then I sit with them sometimes if I have time, and I explain to them the different parts of the human eye, and it's fun because it's a nice activity for them, and they learn about the human eye at the same time. So those are the things, remember, just by looking at the patients, and then other things. I mean, there's so many other things. You can look at them. You can, as you're talking to the patient, you can see Bell's palsy also, like one side of their mouth is droopy, or their one side of the, on one side of the face, their eye is not closing enough, or droopiness on one side, like on the face. It's known as the facial nerve palsy, which is the seventh cranial nerve palsy. So you can see that as well. And then there are certain tests that we do in order to determine if it is a seventh nerve palsy or not. And then the ocular motility exam that you do, or the EOMs, extraocular motility exam that you do in order to determine any kind of nerve palsies. You can also see that, like sometimes when you enter the room and you notice that the eyes are not looking straight ahead. I mean, one eye is deviated inwards, or it's outwards, or it's looking down and out, or it's looking upwards, and you're like, oh, okay, so that's a nerve palsy probably happening. And I have a separate video on the cranial nerve palsies, and I have discussed in detail about the third nerve, which is the oculomotor nerve palsy, versus the fourth nerve palsy, which is the trochlear nerve, and then the abducens nerve, which is the sixth nerve palsy. So you can watch that video, and I have explained everything in detail there. I haven't made a video on seventh nerve palsy, but probably I could. If I have a good case, I'm sure there will be a case. I have seen tons of seventh nerve palsy, Bell's palsy patients, but if I have something coming up, I would definitely make a video on that as well, because that's important, and I have to refer them to neurology also for that. Dry eyes, you can also see, like, you get an idea when they're sitting there and they're saying, oh, look at my eyes, they're red. I mean, even before they tell you, you can see the redness. The redness could be from allergies, or it could be from dry eyes, or it could be from Sjogren syndrome. There's so many things that you can just detect or kind of observe by just talking to the patient. So it's not just like talking, you're kind of examining them at the same time, but you're doing it in a subtle way, like I said. And that is important because that's a time-saving technique, actually. And then you can focus on those things so that you can ask the patients relevant questions regarding what you're noticing in their face. So those are the things. So just remember corneal arcus, anthelasmas, blepharitis, melanosis, and nevus. Okay. And obviously, if you notice any kind of scars, or if you notice any kind of cancer area, for instance, squamous cell carcinoma versus basal cell carcinoma, be very careful about that. Examine them thoroughly. You just don't have to examine the patient behind the slit lamp. There's so many things. You're looking at the patient and determining and detecting so many things, and diagnosing also. So that was all about the human eye. One more time, that's my human eye model, and I love this model because I explain a lot of things to my patients with this model. And I will see you guys later. You enjoy and have a great day. Bye.